cells in the heart, these cells that constitute the myocardium. Now, in these cells, there are troponins. So troponins are chemicals in these cells that are to do with the contraction of the myocardium. Now, if the cell is damaged or insulted in any way, if there's damage to the cell, then what happens is there's actually a breach in the integrity of the cell wall, and the troponins leak out. So if these troponins are found in higher concentrations in the blood, it indicates that myocardial cells have been damaged. Very, very simple cardiac marker testing. Absolutely standard to look for troponins in all aspects of coronary care. So they're looking for those above age and sex upper limits on day 3. Blood taken 48 to 96 hours after vaccination. And very importantly, there was no alternative course. So these patients were screened by proper doctors and scientists. If they had a reason why they might have increased troponins, like they just ran a marathon, that they would be excluded from the study. Other causes of raised troponins were excluded. This is a very thorough, well-conducted study. And I've already seen quite a bit of misinformation about this study already, but it is well conducted. They did exclude other causes of raised troponins. 77 participants, median age 37, more women than men in a healthcare environment. So working age adults, minimal risk from severe COVID, almost none. I mean, all these patients have been exposed many times if they're healthcare workers, almost certainly. Now 40 participants, 5.1% had high sensitivity cardiac troponin concentrations on day 3 that were above the 99th percentile. Already that's high, so 5.1% is already high, showing much higher levels of troponin than you would expect. mRNA 1273 vaccine-associated myocardial injury was adjudicated in 22 participants, 2.8%. God dear me. If someone said to me, look, you could have had this vaccine, as I did, but by the way, there's a 2.8% chance you'll have a vaccine-associated myocardial injury, I would have run a mile. I am furious at not being fully informed about this, and you should be too. We've been treated like mushrooms on this, and it's completely unacceptable. It's just anyway, we'll leave that point there. So 1 in 35 participants, 1 in 35 recipients rather, 1 in 35 who received the booster vaccine had vaccine-associated myocardial injury. I'm just going to read that out again. 1 in 35 of people who received the booster had vaccine-associated myocardial injury. This is a range of adverse reaction that is off the scale in healthcare, off the scale, and yet, in New Zealand and other places, it's still being actively and unethically, some might say, promoted. This is just off the scale risks, off the scale, completely. The only way you would take this kind of risk in healthcare if the alternative was certain death. Otherwise, you certainly wouldn't. We just don't take this level of risk. It's just complete madness. What has happened here? How is this level? Let's keep to the data. Of the 777, 2 women had chest pain. So what we're seeing here is most people here did not present with chest pain, and yet they had this myocardial injury, which could result in a focus for ventricular fibrillation and an adverse consequence that is irreversible. Of the 22 cases with mRNA 1273 vaccine-associated myocardial injury, 20 cases occurred in women, 2 in men. Now, this is the complete reversal of what we got with the passive surveillance. So active surveillance, when we're actually looking for the issue, is showing more myocardial damage in women, as opposed to the passive surveillance, where it was more young men that were affected. Interesting. Pity this wasn't looked for actively before, so young women could be fully informed, give informed consent before they were vaccinated. I mean, as adults, we're allowed to give informed consent for a lot of things. And if we don't give informed consent, then that changes the meaning completely. Completely changes the meaning of something that occurs if informed consent was not given. And yet, this is the case here. Informed consent has not been given because this wasn't looked for and talked about. Troponin elevations were mild and only temporary. Good. No patients had ECG changes. Good. None developed major adverse cardiac events within 30 days. Good. But of course, these people were warned that they had high troponins and knew not to go exercising. All the difference in the world. In the overall booster cohort, so this is the cohort that were boosted. Remember, 777 of them that qualified. Many more were taken on, but some were excluded, so that's correct. Median was 5 nanograms per litre of troponin. Interquartile range was 4 to 6. 50% were in the 4 to 6 range. Matched controls, it was 3. Interquartile range 3 to 5. So basically we've got 5 nanograms per litre in the boosted group, and we've got 3 nanograms per litre in the control group. That is a big difference, and significantly, statistically, that is significant. P equals 0.001, so there's only a 1 chance in 1,000. Very highly significant result that could have arisen by chance. So we accept that as a result. You've elevated on day 3, there were warning, and they knew not to go exercising. And as a result of this, well, we can't say as a result of this, but thankfully we can say no major adverse cardiac events within 30 days. So because, well, we don't know why, but certainly it's possible that these would have occurred if the patients hadn't been warned. No major adverse events following 30-day follow-up. So there was no cardiac arrests, excellent. No acute myocardial infarctions. No acute heart failure, no life-threatening arrhythmias. But these patients had been warned that their troponins were increased, indicating they had myocardial damage, so they knew not to exercise. They were looked after by a doctor. Cases had comparable systematic reactogenicity. So concentrations of cytokines and cytokine antagonists, things that work against the cytokines, were markers of quantifying symptomatic inflammation. So they looked for these things, which was good. Now, they also, I'm not going to go into this in detail, but they had lower concentrations of a couple of factors here. Granulocyte macrophage colony stimulating factor. But basically, these are things that stimulate the immune response. So that stimulates a lot of protection against bacteria, for example. This stimulates a lot of protection against viruses. These were lower in the people that had adverse reactions. Now, the question is, did the vaccine lower their protection against these viral and bacterial infections? Or was it that these protections were already lower, making the people prone to vaccine damage? That's one of the things that's currently being investigated and needs further study. Anyway, conclusion, mRNA Moderna vaccine associated myocardial injury was more common than previously thought. So vaccine associated myocardial injury was more common than previously thought. 1 in 35 people who had the vaccine. Massive. Being mild and transient, more frequent in women versus men. No adverse events. The people were warned. The watchman gave word that the enemy was attacking the city. The possible protective role of the